So how do you avoid getting botched eyelid surgery? Well, that's a pretty tough question. And first of all, it's really important to talk about the upper eyelids and the lower eyelids in kind of a separate way. Let's start with the upper eyelids. What should you do? What should you not do? And what do you absolutely have to avoid? Well, people that don't do well with upper eyelid surgery often have multiple surgeries or they have very prominent eyes. So if you have prominent eyes for any particular reason, you always want to be very careful, especially if your eyes already don't close or are very dry, because it's likely that you're not going to do well from upper or lower eyelid surgery because that tends to retract or even open up the eyelids even more. The second thing is underdo the surgery. You always want to do less. You can always come back and take out more tissue and take out more eyelid skin and take out another wrinkle. But the problem is you can't put it back. And if we take out too much and it scars, you won't be able to close your eye. And this can lead to permanent scarring of the eye and just permanent irritation and pain and redness from the eyelids. And this is a hard problem to fix. I fix it a lot, but I think it's a very difficult problem to fix. The other thing to do is to always think about contour and a natural appearance. I like to place fat in the upper brow because I think this reinflates us. It really restores the natural aging process and it turns us into a much more youthful being by restoring this volume to the upper brow. And this isn't just taking away tissue or causing paralysis of our eyelids. This is actually a much more youthful and contouring procedure, and it tends to be very safe in this particular type of surgery. So those are the main things. You really want to seek someone who does a lot of upper eyelid surgery and someone like myself who fixes a lot of upper eyelid surgery gone wrong. For the lower eyelid surgery, most people seek someone because they don't like the bags under their eyes. And the bags under your eyes can be caused by a variety of things. It can be caused that the cheeks have kind of fallen down, that the fat from behind the eye has worked its way forward, or that the skin is just kind of wrinkly and getting saggy. And frankly, depending upon which or all of those, we assess and actually fix each one of those. For example, if there's a little bit of excess skin on the lower eyelids, I can take away a little bit of skin and reduce some of the wrinkling. Or if there's like a fat bulge and a dark circle under the eyes, I can fix that too by either taking that fat away or usually rolling that fat down onto the cheek and make a really nice improvement. Again, the most important things are to remember, don't do too much. Don't do it multiple times. And if you have prominent eyes, or if you have dry eyes, or if you have eyelids that don't close, you really have to be very, very careful with any of these surgeries because that can make those conditions worse. If you already have botched eyelids, we're happy to take a look, and that's a complex fix. But it can be done and it can make a tremendous improvement. Often what we have to do is either put some tissue back or a little bit more surgery to kind of restore the natural contour of the appearance and to really improve the function so that you're just not uncomfortable all the time. Thanks so much for listening.